Yeah, I mean, COVID-19 has been such a challenging experience, of course, for our whole society. I think as someone who researched, for example, flexibility in workplaces for 30 years and recommended to Senate inquiry after inquiry after inquiry that we needed to have more flexible workplaces, that we needed to support women to earn a living and also at the same time be able to raise their families and care for older parents and so on. I did an enormous amount of research on that alongside many other researchers. And then along came COVID. And, who knew that all we needed was a pandemic to really rapidly transform the culture in a lot of workplaces. And if you look up and down the streets of Adelaide where we are today, there are workplaces where I have gone in and talked to the boards of organisations, to CEOs over decades to encourage them to increase flexibility for women workers. And they now have had an experience of women working at home and working flexibly in all kinds of ways, and men as well. So I think COVID is really driving a truck through some very ancient, well-established cultures, and I hope we will take the positive lessons from that after COVID. And we also had an experience in Australia, for example, under COVID, of free childcare, and we saw what that meant for families, for men and for women and for workers. So I think there's some really important positive lessons out of COVID. I just hope we're capable of learning from them and of not just flipping back to the old ways of inflexible workplaces and putting a double burden on working carers. I don't think this will be the last big virus in our lifetimes. I think we are up for different kinds of challenges coming at us, possibly, other viral challenges, but certainly massive change, probably in many countries arising from climate change. And I think what the last 2 years tell us is how important a really strong health system is, how important the public sector is, and how important education institutions are. If we don't have strong, well-trained workforces who are adequately staffed for the tasks that they face, then crises like COVID, we will really be at risk. And the people who are most at risk in a crisis like COVID, of course, are the most disadvantaged groups in our community: First Nations people, people with disability, people on low incomes. They really struggle to respond to changes, to health risks, and to getting good, clear information that's appropriate for their communities. I think the virus has shown us how important the public sector is, how important our health system is, and how important good government is when we can get it.